A surge in cases of Japanese flu has hit the UK in the last week, amid an Aussie flu outbreak. In the last week, flu deaths have gone up by half, with 27 new fatalities, bringing the total deaths this winter to 85, new figures confirmed today. Another 842 people were admitted with deadly Aussie flu, with 18 fighting for their lives in intensive care with the H3N2 strain. In the last week, 27 lives were lost to flu, bringing the total to 85 deaths since October. Health officials renewed their pleas for people to have the flu jab, adding it's not too late to protect yourself and your family. Experts warned yesterday Japanese flu is rife, posing a particular threat to kids. Professor Paul Cosford, medical director at FE, said the H3N2 strain Aussie flu particularly affects older, more vulnerable age groups. We encourage anyone who is eligible to take up their offer of the flu vaccine. It is not too late. The surge in flu cases is putting more pressure on hospitals amid one of the worst NHS winter crises in years. Flu combined with rising levels of norovirus, the winter vomiting bug, are compounding the problem, with sick Brits forced to wait longer at A&Es across the country. Some 4.5 million people were thought to have been struck by flu, according to the online tool FluSurvey. Earlier this week, the map revealed that deadly H3N2 strain was feared to have spread to all parts of the UK, following a surge in flu cases. NHS figures for the previous week showed that 1,078 people have been admitted to hospital with flu since October across 19 NHS trusts. Of those, 252 people were diagnosed with Aussie flu, a new mutation of the virus. It meant across the UK around 3,800 people ended up in hospital with flu, with about 1,000 of those thought to be battling the Aussie H3N2 strain. And experts warned kids returning to school after Christmas was likely to accelerate the spread of the flu virus. Kids are known as super spreaders because they pick up and pass on infections to their family. Leading flu expert, Professor John Oxford, a virologist from Queen Mary University of London, said, "Now is the danger period." With the situation in France and children going back to school, it could well be a double whammy and fuel further cases. Common sense will tell you that with large numbers traveling backwards and forwards from France, we may see more cases. And kids are very good at picking up infections from each other and then passing them on at home. It's not the best situation to have simultaneously. Professor Robert Dingwall, a flu expert at Nottingham Trent University, told the Sun Online the UK must brace itself for the flu crisis to get worse before it gets better. While it's still early in the flu season, he warned we have good reason to think it could be the worst winter for 10 to 15 years, if not decades. GPs are seeing a lot more flu after opening again after Christmas, he said. We have every reason to suppose we will see more cases, probably more severe cases, and probably more deaths. He warned the NHS is facing an unprecedented challenge and urged businesses to have contingency plans ready, as the number of cases is expected to rise in the coming weeks. NHS trusts may be forced to cancel non-emergency operations well into February, Prof Dingwall told the Sun Online, as hospitals struggle to cope amid the winter crisis. He added, "The French are having real problems and we are likely to see the same here within weeks."